So hello everyone, my name is Melker Nilsson. I'm head of global sales for Nobel Biocare, and with me here today I have the two inventors of our new restorative concept, the On1 abutment. It is to the left here Professor Rompen, who is a professor in paleontology in Liège, and Dr. Bernard Touati, who is a private practitioner in Paris. So I will ask them a number of questions. It is a new concept, a new restorative options, and with so many restorative options available today, why did you see the need to invent this On1 concept? Which clinical challenges did you see that we intend to overcome with this new component?
Well, we always had a concern with healing abutments that you need to retrieve, creating some kind of biological issues. So first of all, this concept is based on a system that you don't need to retrieve those healing abutments. This is number one. And we installed base. On top of this base, we can build a lot of different options, restorative options. And this is clear. So then also we were in a system where we were taken between two options, bone level implant and tissue level implant. And we think that with On1, we can have the best of those two worlds. So those were the first reason why we came with this On1 concept.
On bone level implants, a healing abutment is actually a hurting procedure because we have to retrieve it. And every time we disconnect a healing abutment, we reopen a wound in the body shell. And that's not good, and the goal was here to avoid that, absolutely.
But on top of that, every time you have to deal with bone level procedures, it's complicated and tricky. So our restorative concept is to bring this implant restorative interface to tissue level where everything is safe and simple. So we were driven by the ease of use, mainly, not to invent something just for the sake of inventing something.
Are there any specific indications you had in mind? Any specific indications you would use this abutment for, or is it a universally applicable solution?
Completely universally applicable solution, of course. Of course, for each and every bone level implant, this is good in all indications.
So what specific benefits do you see from a surgical point of view?
From a surgical point of view, the difference is that we will not place a healing abutment. Instead of the healing abutment, we place this, as simple, directly engaging the conical connection, and never removed afterwards. So the soft tissue healing, the mucous integration will never be disturbed afterwards.
And from a restorative point of view?
Oh, for the restorative point of view, it's very simple. We don't struggle, as I said, with bone level situation. We bring this interface, making everything easier because we are flush with the tissue or at tissue level. Then, for example, no need to take an X-ray if you put an impression copying. If you want to cement a crown, it's very easy and safe to clean the cement. Well, everything is simple because it's at the tissue level, visible, accessible, and safe. That's the main prosthetic reason.
So we have mentioned the word tissue level now on a couple of occasions. Why not just place a tissue level implant and have it done with?
Tissue level implants are perfect from a biological viewpoint. They are very good. No problem with that. But the problem is that it's not versatile. If any problem occurs with the flap, if the neck of the implant is exposed, you have no solution for that. Here it's versatile. And in addition to that, we have here a very nice platform shift in which we can have an O-ring of connective tissue stabilizing the tissues. I don't know if you...
Yeah, well, the On1 base transform a bone level implant, especially like active or replace CC, which has a conical connection. They transform it in a tissue level implant, but with all the benefit of the flexibility of the prosthetic restorations. So I think we have, as you say, Eric, often the best of two worlds.
Yeah, one thing for sure, this video is filmed at the the Nobel Biocare Global Symposium in New York, and the interest that we have had for this concept here in New York has been, I think, overwhelming. We knew it was a good product, but it's been overwhelming, and I would like to congratulate both of you for bringing this to the market, and thank you very much for this interview. Thank you.
Thank you, Melchior. Thank you.